Hi there, this is Miss James. I'm going to start recording for you beginning at chapter 10, the expectant family. Some of these things we talked about last week, but I'm going to go ahead and reiterate some things to help you get prepared for your test. So, we're going to talk about the nursing process and how to support the family and the woman during pregnancy. And as we talked about last week, the family is a unit. However, the mother defines it. It could be our traditional mother, dad, siblings, grandparents, or it could be a very non traditional family. It is whatever the mom describes or defines as her family. So, the nursing process. Our care plans, of course, incorporate a database of the normal changes that we expect in pregnancy. Um, Sometimes our nursing diagnosis or in client goals, or however we want to term that, we're kind of getting away from actually nursing diagnoses and talking more about patient problems and interventions. And this leads to the continuity of care between shifts, between day to day. And the problems each woman has, it depends on the woman, and it depends on the stage of pregnancy, and it depends on how many pregnancies she's had. So it's very important that we prioritize our nursing care. So the father, remember we were talking about last week how important it is not to forget about the dad and always include him as long as it's comfortable with mother and appropriate. Sometimes she doesn't want the father of the baby included if there's a domestic issue, but we want to make sure that we include either the father or the partner. How much do they want to participate in the birth? And if it's culturally appropriate, we want to recommend that they attend childbirth classes along with the mom and give them as much information as they're willing to take on. Some dads don't want all the information, but you can assess that whenever you're talking to them as a unit. We want them to express their feelings. How do they feel about the pregnancy, feeding of the baby, their ability to parent, and any questions they have about sexual activity. We want to talk to them, especially during prenatal time, because this helps us to develop a better plan of care for them whenever they do come to deliver. This is the empathy belly. Sometimes we give one to dad for him to see how it feels to have the center of gravity a little off in what the waddling gait is. That usually this belly weighs about 33 pounds. Siblings we talked a lot about last week. We have to include them because they often resent a new sibling coming into the household, or they may feel neglected. And so we need to encourage parents that they still have to spend time with the other siblings, and all of their time cannot be placed just on the new arrival coming into the home. So, cultural considerations. We've talked a little bit about these each week, and we need to be very open and respectful of others' beliefs. And one way to do this is to have a good understanding of how we feel about other cultures first before we can begin to appreciate um, differing beliefs and differing attitudes about childbirth. Each family is shaped by a culture and life experiences, and they have expectations of its member and the healthcare system during pregnancy and birth, and it's important for us to understand what those are. Sometimes language barriers do pose a challenge, so we need to make sure we have interpreters available. Our printed materials are also provided in differing languages, and make sure we have those available. And if we don't, find a way that we can get them. Childbearing decisions, we want to know what the parents' preferences and any previous experiences they've had. Um, we have become so medicinal that we feel like we need to control this for the parents, which really is their decisions. And if they want to have a birth plan, that's perfectly fine, just as long as those birth plans identify options and we allow them to understand that it is an open communication between the parents and the healthcare providers at birth, and it sets priorities of what their wishes are. And it is very important that we help families if they do want a birth plan and want to have a little bit more control on the delivery process, that we explain to them and they make a fully informed decision on what's safest for mother and baby, and understand that we need to have high risk care available. Sometimes the birth plan expectations cannot be met, and so we need to help them to understand what the priorities of care are should the plan not be able to be carried through, because sometimes we run into an emergency situation and we cannot follow the plan fully, and we want to have a good mutual understanding if the safety of the mother or the baby is threatened. Then we have to have the ability to do the best we can to support good, safe care for the mother and the baby. And we need to help them to keep sight of what's realistic in their situation. These are some of the decisions that are important: the healthcare provider, the prenatal services, what setting. Not always will it be in the hospital. Sometimes families want to have a birth at home with a midwife or in a birthing center or with a support person. Some families want to have siblings present at birth, but it's very important to find out any of these areas you choose, what is acceptable and what is not. Confidentiality guidelines, safety guidelines, and are we in close proximity for emergency care should mother need it. The goal is to provide up-to-date evidence-based information to the mom and to the family that she wants included about the labor and birth, what her choices for pain relief are, what our preparations for complications or any other obstetric procedures are available, if she chooses to breastfeed, what normal newborn care is, and what the postpartum adjustment will be. These are the things that are included whenever we provide childbirth education to the mom or into the family that chooses to be with her. These things may include changes in fetal development, childbirth choices, preparation of the mother for pregnancy and birth. If she's choosing to do a vaginal birth after a cesarean section, we want to make sure we give her good, clear information about that. And preparation of couples who choose to have a natural childbirth without medication. We may also offer preparation of grandparents and siblings, newborn care and safety, as well as self-care during the postpartum period. Now, these days, moms usually do not have a full 6 weeks to use up in just childbirth education, and so most facilities will offer a 6-week class or a long 8-hour day and try to get all the childbirth education in that one day because our schedules have become so busy. The woman's goals should include and usually include a way to get more information, an avenue to reduce her anxiety, getting the partner involved, and having an emotional, positive experience during the birth of her child. Common discomforts, and these will be very important for you to understand. Usually in the first trimester, nausea and vomiting, and that could be from elevated HCG levels, a change in her carbohydrate metabolism, and sometimes just her emotions will make her feel nauseous and sometimes cause vomiting. But this usually happens during the first trimester. She'll also sometimes have urinary frequency because the uterus is putting pressure on the bladder, and she'll be more tired. And this is often caused because she's up and down all during the night going to the bathroom. The increased estrogen and progesterone, we've talked a lot about this before, but just as a review, as we stated, nasal stuffiness, sometimes a bloody nose because the capillaries are getting more vascular, breast tenderness, increased in vaginal discharge, cervical hyperplasia because it's getting ready for the developing fetus, and increased production of mucus by endocervical glands. All right, by the second trimester, the baby is getting larger, so there's increasing levels of progesterone, which decreases gastric motility, so she may have heartburn. Because there's slow venous return and increased capillary permeability, sometimes she'll have ankle edema, and that's often caused too because of an increased level of sodium, and this is why we say to be careful of how much sodium she takes in because of the edema, and also runs the potential of increasing her blood pressure. Varicose veins because of venous congestion, plus she's gaining weight. Hemorrhoids are also another discomfort of pregnancy, and sometimes this is secondary to constipation and slow venous return of blood. Increased backache because of lumbosacral vertebrae and the curve because of the enlarging uterus. She may have leg cramps because there's an imbalance of calcium and phosphorus. And here again, she's having fatigue because she's got poor lower extremity circulation. This is an example of how you can give mom some leg cramp relief. He can flex her foot and straighten her leg to help relieve those cramps. Here's some other discomforts. We had talked about it before. Decreased gastric motility and increase in air swallowing can increase her flatulence. She can start to feel more faint if she has a sudden change in position because that might be due to postural hypotension. So we want to tell her to be careful getting up and down too quickly. And there's decreased vital capacity due to increasing size of the uterus, so she may have some periods of dyspnea. Carpal tunnel syndrome is often related to the compression of the median nerve, and that's sometimes precipitated by edema in the hands. So we just want to make her aware of that. So how can we alleviate some of these discomforts? Nausea and vomiting, we want to try to get rid of the odors that might precipitate nausea and vomiting. We can encourage her to eat dry crackers in the morning and not try to eat too much heavy foods, especially during the first trimester. Avoid greasy foods and drink fluids between meals. And the best advice that mom in her first trimester, have her to eat small, frequent meals, not eat such large meals at a time. Same thing with controlling heartburn, eating small, frequent meals, and avoid overeating and lying down after a meal. Morning sickness, sometimes these acupressure wristbands, sometimes they're used to help relieve nausea during early pregnancy. And if it gets too bad, it's important that she talk to her physician to find out what the best course of action to help control nausea. Flatulence, she needs to chew her food completely and try to avoid gas forming foods. You know, some of our vegetables that we really love to eat make us have a whole lot of gas. Dyspnea, if she uses good posture when she's sitting and standing, her ease of breathing will be much better. And have her to sleep in a semi-Fowler's position instead of laying flat. Constipation, she needs to increase fluid and fiber and develop regular bowel habits. We're all in a hurry these days, but it's important that we spend time in the bathroom when we need to so that this constipation does not cause her to increase having hemorrhoids. Encourage her to change her position slowly so that she won't feel like she's going to faint and to avoid standing for very long periods of time. The backache, if she uses good body mechanics and practices pelvic tilts, sometimes that'll help relieve that backache. Leg cramps, she can use heat to those muscles and dorsiflex the feet to help relieve the muscular tension. Here's a picture of mom using appropriate body mechanics whenever she's getting up and down, especially picking up objects. It's the same body mechanics you and I learn for back safety with working in the hospital. For ankle edema, she needs to elevate her legs while she's sitting or standing, and like we've already said, dorsiflex the feet frequently to help improve that circulation. Same thing goes for varicose veins. She needs to elevate as much as possible and wear support hose because remember, we've talked about it several times now. We don't want her to have blood clots, and she is in a hypercoagulable state when she's pregnant. This is a way she can have some relief from varicose veins and swelling and discomfort by lying down with the legs and one hip elevated. That's very important to elevate a hip with a pillow because that avoids compression of the vena cava, which often sometimes causes vena cava syndrome, and that's because the uterus is sitting on top of the vena cava and it can cause her to have a rapid drop in her blood pressure. So she puts a pillow under her back to avoid compression. Hemorrhoids, of course, avoid constipation. And if she does have them, she can use ice packs or sit baths as necessary. Here's a position of relaxation and rest as the pregnancy progresses and putting a pillow between her legs to help offset the pressure. Urinary frequency, she does need to increase her fluid intake during the day and decrease fluid intake in the evening. We don't want her to cut down on her amount of fluids because she needs it, but definitely increase it in the daytime. Plan for rest periods to help with the fatigue and get help from family members or support persons. We all think we need to be super women these days, but we do need help when we're pregnant. Wear a well-fitting supporting bra to help with the breast tenderness. This is very important because those muscles are very fragile in the breast, and if we wear good supporting bras, that helps keep them well supported. Increase in vaginal discharge, she needs to bathe every day and wear cotton underwear. Soap and water is cheap, and it's very important to practice good hygiene. Nasal stuffiness can be relieved by using a cool mist vaporizer. Carpal tunnel syndrome can be relieved by her avoiding repetitive hand movements, elevating those arms as necessary. So self-care that mama can do. For fetal activity monitoring, you don't have to remember the name Cardiff counting method, but what we're asking mom to do is to count the fetal movements in a day and keep a good record, because she should feel at least 10 fetal movements in 3 hours, and this starts in about the second trimester. Vigorous activity usually will give her reassurance that the fetus is doing good. And this is one of the first questions we'll ask. When was the last time you felt your baby move? And if she hasn't felt that baby move within the last 24 hours, then we're wanting to check to see what's going on. Breast care, as we said, wear a good supportive bra and no soap on the breast if she's breastfeeding because it's drying. Wear comfortable clothing, not high heels, low heels, because she ends up having her center of gravity is shifted, and those high heels make her center of gravity even less centered and run the risk of falls. Be aware of cultural norms for self-care and try to avoid falls. And it's very important to encourage her that we need to bathe every day. If she is having no complications with her pregnancy, it's okay for her to work until she goes into labor. We just need to have a good assessment of what type of work she does. If she's around any fetotoxic hazards, anything that is teratogenic to the fetus, then we may have to talk about that. If she's having a complicated pregnancy, we will encourage her to avoid traveling because she may run the risk of going into labor or having problems. If she is flying and there have been no complications, we want her to stay well hydrated, and we don't want her to sit for long periods of time. As we talked about over the last couple of weeks, she needs to maintain regular dental checkups, because usually people who have dental caries are ones who have not had good dental care. They've been throwing up a lot, not taking care of their teeth, and then they end up having dental caries. It's not the pregnancy that's causing the cavities. It's because she hasn't taken good care of her teeth and had nausea and vomiting. That acid has started causing issues with her teeth. No live virus vaccines. This is why, if she is not rubella immune, we are not going to give her a live rubella vaccine until she's about ready to go home. The ratio that I want you to remember for rubella is 1-8. There are some labs who will have a different immunity level, but for our purposes, for rubella, for the titer, is 1-8. We want her to have plenty of activity, but also plenty of rest. Exercise is good for an uncomplicated pregnancy, but we need to check with a healthcare provider for what is safe. And she has to have rest periods. Good exercises to prepare us for childbirth are the pelvic tilt, to help that pelvis get nice and flexible. Here's an example. The pelvic tilt is done on hands and knees with the back flat and parallel to the floor. And we learn these also in childbirth education that we practice. And you call this looking like a cat, just pulling your back up and tilting your pelvis, and it reminds you of a cat. Perineal exercises, which are called Kegel exercises, helps to strengthen the perineal muscles. This is a picture of what Kegel exercises can do, and she learns to tighten her pubic muscles, and it improves the support of those pelvic organs and helps get those muscles back into shape whenever after she's had a baby. She can do inner thigh exercises. Consider alternative positions for intercourse as long as it is safe to do so, but this is something that needs to be discussed with the healthcare provider on what is safe and what she has to be careful of. Avoid teratogenic substances, medications that have not been prescribed, alcohol, tobacco use, illicit drugs, being around pesticides, and even being around x-rays. If she's using complementary or alternative therapies like oils, herbs, she needs to discuss these with her healthcare provider for risk and benefits. Sometimes it's okay to diffuse the oils, but it's not okay to rub them on or take them internally. So it's important for these to be discussed with a healthcare provider, what is safe. The centering pregnancy model, I'm not going to ask you to remember this. It's to help women be more about choosing what they want, how they want their pregnancy to be. But it includes a lot of education, and it's usually in a group setting. But I'm not going to ask you to remember all about the centering pregnancy model. Okay, concerns about the expectant couple might have about sexual activity. Concerns, they're worried about injuring the baby or the woman. They're worried about the changes in their desire for each partner, and they're also worried about communicating these needs between each other. It's very important to be open and honest and discuss these behaviors with the healthcare provider before it becomes an issue, because we're still in a relationship with our partner. It doesn't mean everything is off limits for 9 months. So it's important to ask these questions and feel comfortable about asking these questions. Partners need to communicate their feelings and needs with each other. A healthy pregnancy, there's usually no reason to limit this type of activity. And physicians or healthcare providers, midwives, they will explain how long it is safe to do so. If it's an uncomplicated pregnancy and she does not have ruptured membranes, it should be safe to do so. But those lines of communication need to remain open. If she has been having premature labor pains, it's very important that there is no sexual activity, because that will be harmful to the mother and to the baby. Okay, I suggest that you read over Chapter 10 over some of this information so that you have a really good working knowledge about these things that are important to the pregnant woman and to her family. Okay, in a bit we'll be moving on to Chapter 11.